Hiten Soni, you're going to tell you about sleep.
Well, thank you. So, yeah. No, I'm just going to sit down.
Now you're going to do the whole smartboard, yeah, working for you now, yeah.
Yeah, it's not as good as the last time I had the chalk work, the marker working as well. Anyway, I was looking for a good quote to start with. So this is the one I found where he compares the going to sleep with the death. And I thought, wow, that's pretty good. So all birds and mammals sleep. Is that interesting? Being a bird is like very difficult. I did not know how difficult it is to be a bird. So this is not a chalk-out bird, but do you know the birds don't exhale?
Birds don't what?
Exhale.
Oh,
Right,
exhale.
Yeah, yeah. So they breathe, and then they exhale so it's a one-way.
One way back.
Yeah,
Huh.
so because it would be difficult to fly at 30 miles an hour and go.
Blowing out and be defeat flying, yeah.
Yeah. Anyway, but they sleep, they can exhale, but they sleep. And a lot of weird things that I found out about the non-human sleep that, and we'll see a little bit about why this is so ridiculous. So some horses, not some, all horses sleep, they're standing up, and they only lie down during a certain time of the sleep. So, is that true that you can go like cow tipping and they're like standing, sleeping?
I don't know.
No, I thought
Horses
if
sleep
anybody
standing
knew
up.
it would be in Missouri, in Kansas.
I've heard rumors about that,
Yeah.
actually.
I grew up on farms and I never did it.
Okay. All right.
But they don't push
Cows
over.
did.
I bet they don't push over easy. They're heavy.
So the sleep deprivation studies have shown that you really, really need to sleep, and it's really needed for you to maintain the cognitive ability as well as the psychological health. And it's all about habit, like how you are getting used to it. So this guy apparently can't sleep without this doesn't happen to me. So why we sleep is an important question. So we spend so much time in this thing. Any thoughts from the audience? What would be the evolutionary advantage?
Maybe you're getting a lot of sensory input throughout the day, and so this downtime allows your brain to kind of process everything that it's received during the day.
Okay.
So you're not doing that while trying to find food and eat and basically live.
Okay, that's a very good. Yeah.
I would say-
So that's a restoration hypothesis. So you rest, you restore.
Mental rest,
Mental
and then I
rest.
was thinking physical.
Physical restoration. That's very good as well. Any else? Yeah, those are very valid theories, and we will see. So there are several. One is the evolutionary ecological theory. So this is just it's funny. And so, right. So he talks about that in his book, that at night it would be very difficult for those who didn't sleep. So if you think about at night, if you ever go out like in Arizona desert, when it's really, really no moon night, and you can't see like even in front of your hand, and it would be difficult for pre-human or whatever the ape-like, the ancestor would be walking around at night, and those group that aren't walking around in the dark would not survive as much. So then those who are able to stay put and kind of rest, and then eventually you could develop some sort of a sleep mechanism. So that's one theory. And then the other was that they have, keep you safe because you can't really see where you're going at night. So those animals would tend to just sit down and not wander. So that's what they're talking about, retain that resting. The other one is that what Josh was saying about the conservation of the energy that you would have. So in the conservation of energy, you see that when you're sleeping or just resting, you're spending 10% less. I could live in a lot less, but apparently it isn't. It's only like 10% saving. And the body temperature, and then it decreases, so it compared to wakefulness. That's the restoration theory that Josh and you were talking about. So in depleted energy, it removes waste from the muscles, repairing cell, and again the mental resting and then restoring the neurotransmitters in the brain as well, because you're not using that much in the evening time, those the restoration. And it would be ideal time at night to prepare for the activity for the next day. And in support of that, the growth hormone and other essential enzymes are secreted then at night. So growth hormones is what is needed to do the repairs of the cells, wound healing, things of that nature. And then I wanted to show you some, this is a note for me for supplementary stuff. So for some reason I have this software, but I can't copy it. And so I can only use...
You have to use that laptop?
Yeah. Okay. So it is a software that they had, I got it for my sleep rotation. So I wanted to show you about non-human sleep, and I think it was in lecture, list of lecture, non-human sleep. This was just, so when you are talking about a single cellular organisms, we are not really seeing any, so I'm going to skip a lot of that. The earliest we see in the multicellular organism is this worms, where we see the relative immobility for certain periods. So that's about the only, the highest, the lowest form of life that we can find that shows some characteristic of a sleep. And we'll see some in the higher organisms, but they don't really sleep as how you and I would think of it as a sleep. It's a lower activity state that they would go to. And they're able to see it in the fruit fly, and this is how they would measure it. Every time the fruit fly would go back and forth, it would break this light beam, and you can see how many times it goes back and forth and count the pulses, and you would find that there are periods when they're resting and they're not moving around as much, and so that's another way that you can look at in the zebrafish also we found some evidence of reactivity to external stimulus, and they were able to relate it to particular chemicals, that's the hypocretin, and you can see there was a 30% reduction of the sleep time at night when they had a no hypocretin receptor. No sleep behavior was observed in certain types of frogs. And here you can see there is a resting state and an active state. So what do you think you're measuring here is the one here. This is the EMG that's measuring the muscle activity. So you can see that during the resting state, the muscles are not firing at all, whereas in the active state you can see. And then this is the frontal EEG. So somehow you can put a probe in the front of the brain and you can see the resting state versus the active state. This is occipital EEG in the back, the tree, which is in the back of the brain. You would put a little probe and measure it. So you're seeing something, and you can see the breathing has slowed down considerably. Here is another frog. It's the same idea. You can see the resting states are here, active state. We'll move to little quickly to show you. Here you can see in a crocodile different stages of resting. So you can clearly see that this is the second stage versus first stage versus the being awake. How the postures and the muscle tones are, you can tell. Again, this is in the crocodile. They're looking at the brain activities during arousal and again at sleep. Now I want you to remember this shape here, these two, okay? And then we'll come a little later and I'll show you this in the human brain as well. So just kind of remember what they do. Let me move over kind of quickly. I want to show you some interesting one. Here's the bird. Here's the nighttime activity are the red ones, and the daytime activity. So you can see it's a lower activity in the brain at nighttime. Here, in the same species, you are seeing the REM sleep and non-REM sleep. This is what everybody in this room has heard that, REM sleep and non-REM sleep. And then this is the first time you're seeing it. We go into higher animals, we are seeing it now, the differentiation between the REM versus the non-REM sleep. And here it is in the bird. I want to show you this one, where the pigeons have a unilateral eye closing during sleep. So they're closing one eye at a time. Okay? And I don't know how that is restful to be. But they're able to do it. So they're showing you the left open, right open, left close, right close. Then here is left close, right open. Then left open, right close. And these are the different times during the light phase and dark phase that you can spend the time. That I thought was interesting. And here are the different brain activity during the left and right eyes closed. Penguin. Owls. Owls are really fascinating birds. When I started learning about birds, you know why they can almost do 360, but they can't do exactly 360, but it's pretty close. And I always wondered, like, why that they're able to do that. Because they do not have what's called the extra ocular muscles. So I can keep my head straight and just move my eyes to the left, because I have muscles that pull the eyeball. The owl's eyeball are so evolved to be able to see at night. There's no room around the orbit, around the globe, for any muscles. So they are not able to do this up, down. So they have extra vertebrae in their neck to be able to allow them, because the eyes are fixed in the same orientation as the beak. How do you say it? Beak? So yeah, so they have to track because the eyes cannot. Eyes are so big that the brains are kind of small. So this whole thing about owl being wise, yeah. Yeah. Okay, so we'll skip it, we'll spend too much time. Here are so we see the REM sleep in this. I want to move this a little bit along. Here you see the terrestrial mammals and the brain mass as we go higher. They're getting 18 hours sleep, and here they're getting 3.9 hours of sleep. These are the elephant brain, as opposed to whatever that is, the bush-tailed possum. Okay. So, and now this is interesting, that you would think that smaller brain animals are spending then so much time in the sleep versus the larger brain. And I'm not quite really sure why that is, or why there would be an evolutionary advantage to have that. Let me move a little bit. This is hibernation. Again, we talked about giraffe spending time sleeping, standing up. They would only have to lay down during a short period. And there's this one slide I wanted to show you. Oh, here we go. So they have, the forest seals, they have half sleep, half awake. Now remember in the pigeon I was telling you they sleep, here they sleep with half a brain. Now I'm not even sure how to even describe it. And I'll show you the picture. So they'll sleep with half the brain. And I thought that was fascinating, that how one sleeps with half a brain. So you see the right versus left?
Like to perfect it.
Yeah. Unihemispheric slow wave sleep alternates between the hemisphere. So if you look in this period here, it's awake, the right, then it goes to sleep, the left awakes, goes to sleep, the right awakes, there. And then here it alternates again. Yeah.
Do they notice any difference in behavior of the animals depending on
Oh yeah, so you'll only see one side flipping and doing the stroke for swimming, while the other one would be limp. So that's how they get to the idea. But this is actually measured in the brain, in the EEG. But if you watch them, let me see if there is a picture. No, but if you watch them in the video, you'll actually see that they'll be quietly floating with the one flipper one, and the other flipper will be just limp. And then when the other hemisphere comes, the opposite flippers will be then limp and swimming. Yeah, so I thought that was weird, a half a brain then sleeping. And here is the proof that it's not just a theory. You will see that when one side is awake, the other side is sleeping. And here is when one side is sleeping, the other side is active. And that was, well, here you can see one active, one not, one active, one not. So there is a tone here as opposed to there's no tone in them. So although it is not universal, but we see it in many higher level. So was that interesting? I thought that was interesting. I'm just nerdy that way, but. So this guy, Hans Berger, he died in 1941. I'm not sure when exactly he does that, but he is the one who first figures out that you can actually measure the electrical activity of the brain on the surface. Now let's think about this. For the longest time, they thought during the Aristotle and his time period, and they thought the brain was really a cooling mechanism for the body. All the thoughts and emotions would really happen in the heart. And nobody really thought about this. Like the brain was really a cooling mechanism. Wouldn't you want to be putting it out there? No, testicles are out there. Well, you want to be cooling them. So, but you want to like put the brain, so what's the anatomical position in the brain? It was at the top. Low surface area. Something you want to protect, how would you then protect? So you would wrap it in numerous things, and then you would put it in a box, so it doesn't rattle. So let's see what we do with our brain. We wrap it in 3 different layers, right? Then we wrap it on top of a 4th layer, which is so tough and durable. It's actually called dura mater, durable matter that we would wrap it in. Then we would suspend it in the liquid inside a very tough box. That does not sound like a cooling apparatus. Okay, that does not sound like a cooling. So you have all these things, followed by the liquid, a layer of liquid, then suspended in the outside box is the skull. Then on the top of the skull, we would put even more layers. So we would put fat, fascia, all these things, muscles. The muscles on top of the skull, some people aren't able to move their skull, muscles on top of that. On top of that, then you have skin, which has 5 layers. So you go through all those materials and still be able to read electrical activity in your brain. And he was the gentleman that he first does it. And this is what he records. So this is the aggregate activity of your brain. Now, can you see that like there's a pattern to this? There's a periodicity to that. It's just not random squiggles. What does it look like? Waves, like sine waves, and so on. Yeah. So it's very periodic. And this is how you would then measure it. So these are on these guys here are measuring the muscle. Because people are like, what is that? There's no brain over here? Yeah, well, it's true, there's no brain over here. But unless you believed in phrenology, The phrenologists, do you know what the phrenologists were? Yeah, you guys know. Yeah. The phrenologists were the people who thought they could read your bum and tell you if you were criminal or not. And they thought the language centers were here. Yeah, I know. But here they're only measuring muscle activities. This is then measuring this muscle's activity. And here he's measuring the jaw, clicking. So the brain waves then, they are all given fancy names. So there's delta waves. So the delta waves go from 0 to 4 hertz. So then how do you know it's a 0 to 4 hertz? You would count 1, I don't know what to call this, 2, maybe 3, 4. So this would be either 3 or 4. And this is from 0 to 1 second. So 4 cycles in a second, that's 4 hertz. From 4 to 7, they're called the theta waves. And then how would you know? You would count 1, 2, 3, 4, 5, 6, 7. So this is 1 second from here to here. So that's theta. Alpha waves is like 8 to 12. Again, you would just count it. And this is the rhythm that you would say is a posterior dominant rhythm or alpha rhythm, and next one. And this is 12 to 30 hertz. So the beta activity is looked with the motor behavior. And you will see it when we are moving or walking or running. So, and then the low amplitude. So anyway, what is it that I'm trying to show you here? If that boy that was connected to all those things, he could not fake falling asleep. You could not fake it. If you are asleep, I'd be able to tell you that if you're asleep, if you're connected. You could close your eyes and snore and pretend you're not sleeping. If the baby was crying, your turn to go change the diaper, but you could just pretend to be sleeping. You can fool your wife, you know, oh honey, I didn't hear the baby at all. But you'd be able to tell if you were connected. So when you go to the sleep lab, this is how it really is. They'll connect you with all these things that you say, now, go to sleep. Like, are you kidding me? Like, it's itching everywhere. You got like a 30 thing sticking everywhere. And then when they're putting these electrodes on, you know what they would do? Take a little sandpaper. Yeah, they'll remove the little dead skin. And then they would put the gel. But this is going to sting a little. A little? It kind of, yeah, it's not little, it stings. And then they put in, and then they'll do this. So here they can't take the sandpaper, so they do the next best thing. They got a toothpaste that has a sand in it. And then he'll go like yikes, you know, and then they'll really make sure it sticks. So it itches, and you saw like how many he had. And then they'll put it everywhere, and then put this one thing up your nose, and then the video camera is there, and then they'll say, just relax. You know, this is a good relaxing position. This is William Dement. Unfortunate name, but very good psychiatrist. He was the first one to actually consider this father of sleep medicine. He's the one that came up with this term REM and non-REM. And he couldn't come up with any fancy words, so he just used random eye movement and not random eye movement for temporary words he came up with. He's still alive because, you know, he still speaks at the variety. And he has a book out. It's called The Promise of Sleep, and if you really, you know, have nothing good to do, so it's a good book to read. He writes it in a first person. It's not a scientific type of a book. This is memoir, and it's fascinating things that he talks about. He did research in his apartment, and he would have the dancers come up to his apartment who danced all night and they would sleep during daytime. And then the doormen would be making all kinds of judgments about why are all these 5, 6 women going up and he writes about that. And recently they changed the classification. So now they have changed it. It used to be 4 stages of sleep, but now they have split it into non-REM and REM, and obviously standing for the non-REM 1, 2, 3. So what was the idea? That when he was watching the babies, and he would see that their eyes would go, you know, in unison, and then he watched the adults and he found them, and then he found there were times that they had the eye movements and the times that they didn't. So he would wake people up and ask them, what were you doing? Sleeping, man. You didn't want me. Like, what were you doing? It's like, oh, I was dreaming. And then they'll say, it's non-dreaming. So you have a lot of dreams. So the most dreams you remember are those in the early morning when you just wake up. But you are dreaming most of the time. So that was the difference between the REM. So here is the hypnogram, what is also called as a sleep architecture. So look at, this is something interesting now. Stage 1, 2, 3, and 4, this is an older graph. Okay, so now it would be N1, N2, and N3, okay? And look at this. So you go through this deep sleep, right? And then right around here, you come into this REM sleep. Now this sleep is considered deeper sleep than these sleeps here, but look how close it is to being awake state, okay? So, and then again, sorry?
Mentally close to being.
Yeah. So if you look at it, it's just, that's why the red things, they would often call it paradoxical sleep, because it's kind of a deep sleep, but then your brain activity is closer to as being awake. And then you go through this variety of cycles during the night. And then you have more frequent REM as the night progresses. So if you see there are longer period and then more frequent period. And then you finally awake in the morning. And then you have some the non-REM sleep. They have just changed it recently in 2007. There is a little dreaming in their non-REM sleep. Stage N1 is from 8 to 13, and then you can go to 47. You can hear some sudden twitches and hypnic jerks. So you feel like you're going to fall, and you kind of experience that. That's what they're talking about. Some people experience hypnagogic hallucination. Now, there are two types of hallucination called the hypnagogic and hypnopompic. The hypnagogic hallucination is when you're falling asleep. You may experience there is a presence in the room, and you're struggling to keep your eyes open and see who's in the room, but you're kind of paralyzed and you can't really open, and you feel that panic. There's somebody in the room. I want to open my eyes and look. And this is the kind of things that people will report. Alien abduction. In the Middle Ages, they called it demons visited at night, spirits visited at night. And I had people would tell me, oh, the night before my grandmother died, I saw her in my room, and then in the morning they told me she was dead. And, you know, that kind of thing. So her spirit actually visited me at night, and so things like that. Those are hypnagogic. Hypnopompic hallucinations are when you are just waking up and you see, I usually see spiders in the morning. I don't know why spiders. But I would open my eyes and I would really see a spider on the wall and say, wow, wow, wow. And there wasn't any spider. That frequently happens still. And now this is something interesting to note, the muscle tone. And so in the N1, you lose some muscle tone, but you're still conscious. That's the problem. You're losing a muscle tone. Muscle tone is an interesting phenomenon. So let's try to just see what the muscle tone means. So I'm standing like this. None of my muscles are moving. Are my muscles firing?
Sure.
Yeah, absolutely, because standing up is an active process. The brain must fire variety of muscles to keep me standing up, so even though I'm not moving. Okay, what if I were just laying down, not moving at all? Are my muscles firing? Absolutely, your muscles are firing at night. Because if you lifted my arm and you told me don't offer any resistance, you would still feel some resistance, as opposed to I'm completely sleeping. So in the ER, there are people who pass out, like, oh. And when they pass out, they carefully position themselves so they don't just fall. And then when they have, passed out, and they can't hear you, and they say, Annie, I don't know why they're always named Annie, but Annie. And then you take the face, the hand, and then you go like this, and you drop it. And if they were really passed out, it would really hit them in the head. But conveniently, right before it goes, the hand would just fall off to the side. For a hand to fall off to the side at the last minute, deltoid and the rotator cuff must fire to be able to do that. Yes?
I know a guy who was an EMT, and he said when they get calls about people who were, like, they get a call from a cop who busted a party that somebody was passed out and not responsive. So what they do is they open their eye and then just get their finger closer and closer to the eye until if they were actually passed out, they wouldn't react, but eventually they'd freak out and
That's
try to stop
another
them.
one.
Yeah.
Okay, okay, so you do have some people that really do pass out, though.
Oh, yeah, and they'll hit their head though.
Yeah.
So,
Yeah,
yeah.
okay.
Yeah. So that's like a, convenient way of, that's the whole thing about the muscle tone. So what I wanted to show you, remember that how the curves look different for different frequencies? You can actually look. So you're able to you don't even need that much training to be able to look at the waves and tell what stage of sleep they are in by simply counting the number of cycles. So when I did a whole month in the sleep lab, and we spend a lot of time with these people whose job is just to stay awake all night and watch you on the monitor, and they would just, they would freeze it next day, and it's all done on the computer now and not on the paper. Yeah, even the internet, it's on the computer now, so, yeah. So, and they have these things and they will count, and remember the shape I was showing you that I want you to remember? Now look at that, that's called the K complex, and this is our sleep spindle. When you see these, what it is showing you is the localized firing of a brain, a center of neurons that are firing, and that tells you what stage, they're characteristic of a particular sleep stage, and that's when you know that person is in a particular sleep stage. So, what was the creature that I was showing you in? It was a reptile. So these are a signature of the reptilian type of activity. So yeah, if you needed more proof of the brain activity,
So-
different species. Yeah.
I'm curious about that. The duration, in other words, you're seeing the brainwave rise up, or is this pattern being repeated over and over?
No, this is just randomly showing up in a different areas in your brain. It will show up, and so depending on where the electrode is located, and if the cells under that electrodes are firing, that it will pick up at that channel. So depending on what channel that you are looking at, it kind of tells you.
Right.
And so that was a characteristic of the stage 2 sleep. And this is a 3, and then you see the delta waves. Again, that just means a different frequency. Now here is when you're supposed to lose the body tone. Okay? And then I'll show you a little later what happens if you don't lose the muscle tone, and then you end up walking in your sleep, or end up peeing at night, and then somnolently when talk in your sleep. So my wife does my sleep talk, and there is this couple of phrases that I say in our native language, and she goes, I never see you talk in language, but when you're sleeping, you'll almost every other night you'll say the same phrase, and then, but she says, but I can't make out. I know the language, but it's just mumbled. And then eventually she was able to put together what the phrase was, and she told me the phrase. Then the phrase was, everybody go home, no, something like everybody go to your own home, or something like that. And I remember, it's like, yes, I know that phrase, because when we are playing, and when it's time to stop playing, the mothers would come out and yell, everybody go to your own home. And it was like, that's what you are supposed to do. And so that was what I was yelling in my sleep. Apparently I keep doing that every other day. Okay. And again, we talked about how do we know when it's a REM sleep. Remember he had electrodes around the eyes?
Yeah.
And that's what he was measuring, is the movement of the eye. And so that's when the most memorable dreams occurs. Remember those dreams were more frequent and longer towards the morning? In that, yeah, so that's how you remember those. And then you get this descending muscular atonia is seen. And then you get the sleep paralysis. The sleep paralysis is really a protective mechanism, because if it was in the dream, if you have a dog that sleeps in your bed, it shouldn't, but if it does, you'll see they'll have their, yeah. So for some reason that the brain activity in the dream, they're running, it's like, how do you know the dog's dreaming? And you'll see that they're running. And our Zoe sleeps, and then no matter where she's sleeping, she's a little Dawson, and she comes and she sleeps like this, right behind my back, and then she'll run, and then I'll wake up with all the scratches on my back, and it's from the door, all right? Just
Yeah, yeah.
okay. So, and the fear that we have are different. You know, like the little kids have this fear about boogeyman in your closet, but she has a guest room for all. So here what happens now, look at the sleep. This is what's called the sleep architecture. Now you understand that these are the 1, 2, 3, the REM sleep. So these dark boxes are the REM sleep, and if you go over it, then that's when you're awake. So look how in the children you have more predictable, equally spaced. In the adult, you're getting longer REM area towards the morning. You got 1 or 2 awakening in mind, and then you become older. Hair is not the only thing you lose. You lose the REM sleep as well. So people will come and he goes, well, I didn't sleep at all last night. Oh, yes, you did. Look, you had all the sleep, right?
Yeah, well,
But look at all the time that, yeah.
Well, I had 2 questions.
Yeah.
First one was, on the last slide, you were talking about the self-preservation,
Yeah.
the paralysis. So do I understand correctly that the myoclonic jerk is caused kind of like by hiccup in this switch over from like conscious control of motor action to unconscious control? Right. Or is that what, you know, no. Is that like what you would consider like a hiccup in the switch over process?
And that's you, and I'll show you
well,
what
It
happens.
happens every night, but
The
you
signals
aren't always
link,
aware of it.
they go through, there is a barrier,
Yeah.
and the signals will go through, and you'll see that in the circuit what happens.
And on this, it just strikes me that like,
Yeah.
so, like, on any one of these, right before you hit REM sleep, I mean, it's like, you just rocket up towards this more wakeful state. I mean, just like that. Is there some signal that, I mean, that
Yeah,
all of a sudden?
It's not known exactly where it happens, but you'll see that between the REM and then awake, it's very, yeah, it was very, very close.
I mean, it's like
Yeah.
you're in very deep sleep and then instantly, like with that graph anyway, you're back into REM sleep.
Yeah. Yeah, so it is, and that's why you will see people doing things that look like they are awake when they're doing the sleepwalking. Because that's why it is then dangerous, because in my dreams, I do some crazy shit. You know, and then you're like, can you imagine actually doing it? Yeah, and there's a comedian, he talks about how he was dreaming that he was in a war, and his job was the tracking device was in his body. So they told him to save the platoon, jump out of the window. So he jumped out of the real window to save the platoon, you know, and it was like from the second floor, and he's all bloody, and he's on the front door, and then he has to go in the hotel because he's awake now. Yeah.
So what I'm asking is though, like this little spot right here,
Yeah.
what's the signal that causes this sudden rocketing to a more wakeful state?
Don't know. That's a very interesting question. But no, you know what the problem is that we don't know? Because we are, look at how we are measuring it through a shitload of things, and it's an aggregate behavior of so many neurons. So we don't have really a resolution to see what part of the brain is doing it. Secondly, it's like a basketball. You can only measure the resultant activity on the surface, but it's all the way through, it's a neuron, so can't tell you what circuits are firing to be able to do that. So I was supposed to go to the aging, but we'll see it in here. So this is another graph that shows the same thing. The baby's been spending a lot of time sleeping, less time sleeping, less time sleeping, waking up frequently at night.
Yeah, that's not enough wake-ups.
Yeah. Yeah. My dad is 83, no, 83, 80, around that, 83, 84. He'll tell me, I haven't slept in a month. It's like, Dad, I can hear you across the hallway snoring. But that's his perception, and we'll see that he hasn't, stuff. And then the cycle not only shifts, the timing also shifts. So that's why they're eating that 4 o'clock dinner and going to bed and getting up at 3 o'clock. The teenagers then are staying up till 2 o'clock and then getting up at 10 o'clock because it has shifted. So yeah, we will see that in just a second. So here is another slide that's just showing you more awaking. So, yeah, well, he couldn't sleep. So let's talk about insomnia. Insomnia then is a condition that most of us experience a few times in our life. And what it is that it's inability to fall asleep. So there are 2 kinds of insomnia. You can't fall asleep, and then those who do fall asleep can't stay asleep. So it's called sleep onset insomnia or sleep maintenance insomnia. And there is a reason, we will see a little later, why is it important to be able to tell which one are you experiencing, because the treatment would be a little bit different for each. So it's not surprising that the people who have the same sleep deprivation, the tiredness, fatigue, inability to concentrate, and irritability. Can you think of another psychiatric disorder that would have some of these symptoms?
Depression.
Yeah, excellent. So for 2 years when I was, not me, but other people, not me, but the other people for 2 years, when they were giving out depression treatment, never asked the patient, how are you sleeping? Then I go to a sleep rotation, and it's like, wait a minute. You ask them how you're sleeping, and they're like, yeah, my sleep is not good. So we always thought, well, that's because we thought the sleeplessness was a symptom of depression. Later we found out that sleeplessness can cause the depression. It's like, oh, so don't treat the depression to make them sleep. Make them sleep to treat the depression in the first place. So a lot of people that were getting antidepressant would have been better off sleepy first in order to improve their sleep. Yeah. So here, again with Dr. Demand, so then he's the one who says that, before you go start treating people for ask them, how are you sleeping at night? And how are you doing it at night? Yeah, this is a kind of a... So primary insomnia, can you die from not having enough sleep?
Sure.
Yeah, yes and no. Nobody's really died from just not having, like staying awake like for 8 days or something. But there is a condition called fatal familial insomnia. That's not a very good name, yeah. Because these people will eventually die. But it's a neurological problem, okay, that they can't sleep. And the diagnosis is of the primary insomnia. Anytime you see the word primary in the front, that means they have something very organic, something wrong with the organ. So patient must have problem sleeping for at least 1 month, and lack of sleep is not resulted from social occupation. So your dog has died, your pickup doesn't start, what else happens? Your dog dies, your pickup doesn't start, your wife leaves you, things like that, yeah. Your tractor has a whatever, and so that's not insomnia. Yeah, that's just being a bad cowboy. That's just, And so it's not other things like narcolepsy and sleep. You were talking about something switching. The reverse could happen. I could be awake, something happens, and I could go into the REM sleep. So these are the people that have the cataplexy. They just fall, and they'll be perfectly awake and talking, and then just collapse because they went from awake to the REM sleep really quick. So they were awake a second ago and went into deep sleep the next second, and they can just come out of it because neurologically those states are so close. The narcolepsy is one where they fall asleep in the middle of the sentence. My wife does that. We'll be watching a show, and then she'll fall asleep. And I ask her to turn over. Then, like an hour later, who is this guy? Wasn't he with them? Is he the one that was driving the truck? Like, no, that was a different episode. You slept, this is a different... I thought he was the boyfriend. It's like, no, just sleep, it's like... so it's to her, she was just watching the show, and she just blinked and opened her eyes, and it's just different characters, and she's completely lost. So anybody in this room snore? Yeah.
I'm not there.
People tell you that you snore?
I can hear myself.
You can hear yourself? Yeah. So, so I have to tell you, please, get it, get the sleep test. What they find. He's not on camera. Okay. Yeah.
They said not.
No.
There wasn't. They, said you snore, but it's not anything.
Problem?
No, health problem.
Yeah. So we will see that. One of the possible causes for the jet lag we're talking about is this desynchronization of a biological rhythm. And we will see what these biological rhythms are.
So it says that RLS is caused by the inability to sleep can cause let's say, I actually find my RLS happens when I don't get enough sleep.
Yeah.
So if I get sleep, it goes away. If I don't get enough sleep, then I get it worse. It gets worse and worse.
That's what I'm saying. It's not really easy. The same thing with the depression.
Yeah.
Cause or effect.
Yeah.
It's
I
not.
get enough sleep, it doesn't bother me at all.
Yeah.
I get enough sleep, it really bothers
But then there are people when they have that thing that they can't sleep. And I'll show you the nerve the firing for the RLS. So as I was telling you before, that if I'm standing here, the different muscles are firing. So it's not the whole muscle is firing as it is doing it right now. In order to me to do this, entire muscles in here has to fire at the same time. So the nerve has to tell each unit to activate at the same time. In the RLS, what happens is the random units are randomly firing. So you're not getting this purposeful movement, but you're getting these random twitches where you don't really feel the random twitch because the leg really doesn't move, but you have that sensation of the leg moving because these random units are firing. So what does that mean, unit? So if I had like an empty bowling ball, it was like completely hollow, but it looked like it was a regular bowling ball. And if I were to just come up here and just pick up, and it only weighed like 5 grams. So all of a sudden, I would be ready to pick up a big bowling ball, and I say, this is lighter than I expected, so I'm not using as many units. But if I had a little ball like this, baseball, weighed as much as a bowling ball, I could reach over and pick it up, and then the moment it tries to move, I recognize, man, that thing weighs 9 pounds. So all of a sudden, more units have to recruit. Anybody ever felt that? You go over to pick up an object, it was lighter, and then it's heavier. That's what the motor recruitment is. So you have like lots of units that fire, but if all those units are randomly firing, your leg may be just laying there, but you feel in the morning like you ran a marathon. So you wake up and it's like, well, I didn't move, but you have this ache and pain and this sensation of constantly being restless. And I used to not believe in these restless legs things before I went to med school. But if you see it in the lab, to the people who are actually experiencing it, and when you see the tracing, you then become delivered. And I'll show you some of that. So here are the idiopathic insomnia. That's just a fancy word that means we don't know. Yeah, it means we don't know. So when they say, oh, it's an idiopathic liver disease, it means it's a liver disease and we don't know what causes it. It's just a fancy term, but you're getting like free.
So the word idiot is in there.
Exactly. So this reticular activation system is something that I wanted to talk to you about. Does anybody ever get drunk and have this wake up in the morning, and for that brief second before you awake, your brain is then booting up, and that's what the RAS is, reticular activity. And then for a second you will check, do I have a hangover, where am I? You know, that kind of a booting up. And then it's like, oh, you don't have a hangover, and it's like a little pleasant feeling, or you do have a hangover. And then a few seconds later you realize, oh, that stomach feels horrible. Oh, that mouth is very, very dry. That feeling, it takes a few seconds to kick in. Okay, just me? Nobody's ever been?
We're all people.
Yeah, okay. Yeah. So, well, you know that little, because it's delayed, that happens normally when you wake. So the RAS is a booting system when you awake. So if you imagine if you didn't have, that's when the people wake up and then they don't know where they are. And that's what's implicated in that. This is a perceived insomnia. I remember I was telling my dad felt that he had not slept in months. And they come in and they say, you know, I am not sleeping at all. I've stayed up for 5 days. I'm really, really tired. And then you hook them up in the lab, and then they are fine. Well, your machine is screwed up. So then we do this. Okay. So you have this thing, and every time you hear this tone, you push the button. So if you're awake, That's all you have to do. Whenever you hear it, you push it. So they'll be pushing it, and then they'll stop pushing it when they hear it, because they're not hearing it, because they're sleeping. And in the morning, oh yeah, I was out pushing the button all night. And it is true, because they're not lying as far as they are concerned. They're telling the truth. So what is the discrepancy is that if you go to, like I say, a boring speaker's lecture, not this one, but other lecture, a 40-minute lecture could sound like 4 week, whatever, because it's so boring, the time is just going so slow, so you're being there awake for 20 minutes, it's going to feel like an hour and a half. And that's why they have this perception of having stayed awake. And then in the morning you show them the pattern, and that you didn't respond to the tone, and then that's done. And so that's what they're talking about. And so this is what you're sitting there, really trying hard to sleep, and then the more harder you try, then the less it is to sleep. Yeah. And I'm just afraid that this is going to happen someday. In the Catch-22, there is a story where the guy goes and tells the sergeant that, well, I can't come to work, or I came to work, but I'm so tired that I dreamt I was awake all night. And it's like, that's the, the humor behind the Catch-22. You know, you dreamt you were awake, but you were sleeping because you can't. Causes of insomnia is stress. This gentleman, you think he's sleeping well? Yeah, he doesn't have anything that would be stolen. This is daytime, sleeping quite well. This one goes So stress. So stress results in activity in the sympathetic branch of the nervous system. So here's what happens in the stress. So whenever you stress about anything, really, will I get laid off tomorrow or whatever, it activates, there's a system, the sympathetic versus, you all know about the fight and flight response. So it activates you pumping, every time you're stressed, you're pumping more epinephrine, norepinephrine, cortisol, all those hormones you're pumping in your system, and they take a long time to get away from your bloodstream, so it keeps you from sleeping. So the stress then is the #1 reason. So I have patients during my first year who come in, and I'm very depressed, I'm going to kill myself. Like, fine, how are you sleeping? I'm not sleeping well at all. So we give them a drug, it's called trazodone, which is a very old antidepressant. So we give them 50, and then, how did you sleep? Oh, not that good. So okay, next day we give him 100. I say, how did you sleep? He goes, oh, you slept really good, he's out. So he sleeps well for 3 days or 4 days. He goes, how are you feeling? Well, I'm not suicidal anymore. Sleeping good, so he's not as depressed. It's like, well, you're cured, you go home. So he goes, okay, I'll go home. Hey, can I get that sleeping med? No. So he goes home. You think he'll sleep? No. He has a rebound. Sleeping sound. So he goes 3 or 4 days sleepless, and he's back in the hospital. And that's what we do.
You don't give them a script for trans?
Well, we can.
God, I was on trans for years, but I finally got sick of the morning hangover.
I know, it's the hangover effect, and people, if you give them, they don't take it. You go, well, if I'm going to have a hangover, I'll do a 5th.
Well, it's not that kind of hangover, though. Your stomach isn't involved.
Yeah, but that's people. Yeah, we give them trazodone, but the thing is that it's not even indicated for it. So it's really a malpractice. to use a medicine that is not meant for, it's an antidepressant. And our program director has a
Oh,
whole
well,
speech on that.
Oh, well, I was depressed too. But it actually,
So these are the kind of things that you would have stress over, you know. So, and you can have it does change, and then it becomes chronic stress, and it becomes like a cycle. Because every time you go to the bed, it's like a negative reinforcement, it's not a good experience. So one of the things that we would tell people is, if you can't sleep for 45 minutes, you get out of the bed and do something else. Then come back and try it again. And the stress and insomnia link is just, it's proven, and you can see lots and lots of report. And this is the research.
yeah, I don't know, you went through that, but I find that the worst for sleeping is anticipatory stress.
Yeah.
And, yeah, I'm retired, so I don't get up very early. But Wednesday morning, between 7:30 and 8, I've got to have my dog at the vet for surgery. I know I'm going to sleep like shit Tuesday.
Yeah. Yeah, like tonight I'm not going to sleep so well because I have to go home and do like 2 hours of notes, and then I got like 3 more hours of assignment at 6 o'clock tonight. And Josh and I had a discussion. These guys are so happy. You know, it's like nothing to worry. And this is the homeless family somewhere in India. And we have an Indian comedian who talks about there is no homeless problem in India, because in order for you to be homeless, at some point you must have had a home. But these people were born and raised in on the street, so there are generations of people
That is their home.
that's their home. So it's not a homeless problem. And the age is the second, where we looked at the melatonin product. Now somebody was talking about the melatonin.
Yeah.
Yeah,
Yes,
what were you saying?
I just, you know, I do have a prescription for Ambien, but I don't take it every night.
Yeah.
I mean, I take it less, I take it 2 or 3 times.
Okay. Yeah.
But then the other nights I take the melatonin.
And then
And
I'll show you.
It sort of helps.
Yeah, I'll show you the reason in about the melatonin. So let's just see this real quick about the allergy. So the substance. Okay. So any drug prescription that will interfere with the circadian rhythm, the caffeine, and the nicotine. So this is what I learned in my sleep rotation when people will come in. It's like, I can't sleep, can you give me Ambien? It's like, sure, what other medication are you taking? Adderall. When are you taking it? At 8 o'clock and then again at 6 o'clock. So you're gonna like take an Adderall at 8, or you're gonna take another Adderall at 6. Well, I have to do some homework. So I'm going to take another Adderall. So now it's like driving with the one foot on the gas and then the other one on the brake, and then really giving it a gas and then really giving it a brake. I can't stop at the red light. It's like, yeah, take the foot off the gas. You'll be able to stop. You know, I can't go as fast. Well, take the foot off the brake. That's what you're doing to your brain. You know, telling it to wake up and then telling it to go to sleep. So it's, yeah. Then we do caffeine. I can't sleep at night. How much coffee do you drink? Oh, I don't drink any coffee after 4 or 5 o'clock. Oh, what else do you drink? But I do drink 8 Dr. Peppers. Oh, I don't drink any coffee. Oh, do you drink any Red Bull? Oh yeah, it calms me down. Really. It's got 7 cups of caffeine in there and it calms you down. Oh, Rockstar. I drink this Rockstar.
Calms them down?
That's what they tell me. They drink this Rockstar, 4 of them. Like, have you read the label? Yeah, and then they want the Ambien, and it's like, but the ad said to ask your doctor if it's right for you. You know what? It isn't right for you. So during in my sleep rotation, I'll be doing this, and then, my supervisor, I won't say her name, she'll come in. He goes, that Mexican guy, he wouldn't give me the Ambien. So because when I go and I talk to her, and then she would say, did you educate the patient about the sleep hygiene? It's like, yes. And
Hygiene?
that's what it's called, sleep hygiene. Okay, and that's what it means, practicing proper. So it's called sleep hygiene. So you're supposed to educate patient on the sleep hygiene. So they come and then they have these things, and it's like, so Mrs. So-and-so, you have to stop drinking caffeine after 1 o'clock. That means no Dr. Pepper. Well, I have 3 glasses of wine, it helps me calm down. It's like, no, you can have 1 glass of wine once a week. Couldn't you just give me the Ambien? It's like, well, we want you to try these things and come back. And then by the end of the month, I'd have 8 prescriptions written in the morning in the left pocket. It's like, here you go. Thank you for coming in. And yeah, it was hard, people coming in. Because, you have this, they watch these ads, this butterfly flying, and they want to be sleeping. And I'll show you some interesting results. And so caffeine, alcohol really, really helps me sleep. My mother used to give me a shot of brandy when I couldn't sleep. It's like, your mother did go to the medical school. Don't do that, You know what the problem is with the alcohol? Yes, it helps you sleep. Does anybody ever take NyQuil to go to sleep? No, just me. All right. So I take NyQuil to go to sleep, and I go to sleep. But when you wake up, it's the brutal waking up. It's not gently waking up. It's like you sleep 1 minute, and then you're awake. Like, what the hell happened?
It's like somebody grabbed you by your feet and pulled you out of the bed.
I know.
Hit the floor.
It's just horrible. So what it does is the later sleep architecture is totally ruined when you drink a lot of alcohol. Okay? People will do this, and then they can't sleep. Then I give them something to sleep. Hey doctor, what are the side effects? Really? Did you ask your dealer what are the side effects of these? No. But isn't this not natural? Yeah, like cocaine is? Well, I guess it is natural. The television. The television. How many people have a television in their bedroom?
No.
Yeah. No television in the bedroom, please. Why? So the melatonin. So when we are exposed to the bright light, it suppresses the secretion of the melatonin. Okay? So you watch television and you think it's a bright light? Yeah, it's a bright light. So it suppresses. Secondly, in the old days, they would have only 1 or 2 cameras. So if you watch the honeymooners, there is 1 camera in the living room / kitchen. That is Ralph's apartment. So there's only 1 camera. So they are not doing that. In the modern production technique, especially with there was a show that was called NYPD Blue. And they came up with this new filming technique that used to make me nauseous whenever I watched it. They did this in the scan, and then they would zoom in on an action. That duplicates scanning the environment frantically and then focusing. That activates the system, and you're pumping out more and more cortisol, epinephrine, norepinephrine. These are stress hormones. So simply by watching 4 murders in 2 hours, activates your system, and then you're not. And then you end it with the Fox News, and then you can't sleep. Yeah. So.
I'm not saying I don't watch TV at night, but not for
Yeah,
better.
So, but it's only the light and the visual component of it, because I'll put the TV on, and I'll put the timer on, and I will close my eyes, and I'll just listen to something, and it has to be something that I've already seen, because I know what's coming, and,
Yes.
and that's soothing.
Yeah.
Right.
Or something boring is good.
Yeah.
Soothing and boring is good.
Right.
But
Or
the
I-
light component, you could do the,
Sleep mask.
yeah.
Right,
the
sometimes,
mask.
sometimes if I can't sleep, and this is usually like in the middle of the night, I'll turn on the NPR station and they're doing the BBC, and I'll turn it to where I can't quite make out what they're saying. And somehow, and I'll work at it, and it's like, oh, it's too much work, and I fall asleep.
Yeah. Yeah. My wife goes to
Straight-
sleep to the Skeptic's Guides to the Universe. She'll say, why don't you play that podcast? It makes me fall asleep. I was like, oh, honey.
Doesn't make me fall asleep.
I know, doesn't it? Like, I get raved up when I listen to that. And she has just the opposite effect. It's like, it just makes me so upset when they describe some of the things that happens, you know. And it's like, how do you fall asleep? And she'll go, oh, can you play that anthropology lecture? Like, that I could play. We can both sleep. But so when you can't sleep, then this is what you want to be doing. But then this is what we end up doing. You know, and it's just, and after a month of the rotation, I just gave up. It's like, here's your Ambien. And I can't imagine, she's doing it for 20 plus years. The snoring people, when you wake yourself up, it isn't the sound that's waking you up, it is your brain telling you to wake up, because what happens is, I'll show you, it's the movement of the air has stopped, the oxygen level has dropped, and that's what kind of is waking you up.
Well, I can actually hear myself snore. I'm still asleep, and I can hear myself.
Yeah, I do too. So there are two types. One is the central apnea. So in order for me to breathe, the diaphragm has to fire. That signal has to come from the brain. So if that signal is delayed or blocked, the diaphragm isn't going to create the low pressure for the air to rush in. So that's a central apnea. So premature babies will have a lot of central apnea, where the brain is not developed and not firing and telling the diaphragm to create the low pressure. So they have this little belt that's put around the infants, and then it's attached to a little computer that expects that the child should have been breathing by now. If it doesn't, it sounds their alarm really loud and wakes up a child, and it breathes. It wakes up the parents as well. That's a central. The obstructive is, we'll just move along a bit faster. The obstructive sleep apnea is anything that blocks the airway. So the first time with the snoring, they would give them allergy spray. Sometimes something as simple as a saline solution could work to reduce it. The second one is obesity. There is one paper that was published that said, don't even worry about doing the sleep study, because that could cost as much as $1,200 to $1,800. And so what they started doing was measuring the collar size, just asking what collar size, and just measure the neck. If it's above 18 or it's above 20 for so much height, you already have obstructive sleep apnea. And it was remarkably accurate. And so, let's see that. Yeah. This is another, so that's the obesity related. My wife is, if anybody's seen her, she's not obese, she's very, and she snores like a train, you know, it's like and we couldn't figure out the why. So when we went, and then this is what I learned to do, asking people to stay. So if you look, these are the class. So if you see, this is the class 1. Okay, so you see how this is the normal. Now this person is not obese at all, but has no area. So, and here is, so if you're in the class 2 or 3, so if you're snoring and you're in this range, like you might have been, and they don't see your oxygen level drop, you don't need the treatment. But if you are in this range here, where the waking up is not the sound of the snoring, but it's your brain telling you the oxygen level is so low, please wake up. And that's what that is. So these are this is the obstruction they're talking about. So class 3 and 4, and here is the normal airway. This is gives you the, and here is where it's falling back and blocking it. So what you hear is the flapping of this thing here. It's called the epiglottis, that prevents the water from going into your lung, and sometimes you aspirate, and that's when it's not working properly. So it's epiglottis. So you're hearing the vibration of this. So I see those people selling you the little for your nose. Yeah, this syndrome. Yeah, but that's not where the problem is. The problem is down here. Here's another graphic. You see how the tongue is dropping below, and this is the normal. So what they do is, one of the treatment is to force the air in. So when the lungs are trying to breathe, you pump the air at higher pressure, and that higher pressure keeps this area open. But you have to keep your mouth closed so that would happen. So this is called the CPAP, constant positive air pressure. So it's pumping air in so you can breathe. I used this for the longest time till I lost a bunch of weight. At one time I was pushing like 250, 252, and I had like a size 22, not this kid, with a huge neck, and I couldn't breathe. But when I lost a bunch of weight, I learned to use it anymore. And this is what it kind of looks like. And then there's a whole industry about making these different machines and making different the masks, and that is true, that it will There is this another one, it's called the BiPAP, where the machine has a sensor, and so when it only delivers a high pressure when you initiate the inhalation, and it drops the pressure when you are about to exhale. So that's the bird thing I was telling you, the bird can exhale when there is a high pressure. So that's why you want lower. Then you have to go to the sleep study. So in the sleep study, during the first half of the sleep study, they'll measure what is your lowest oxygen level going to. So if your oxygen level is dropping to 70, 50, 60, then you want to, the other half of the night, they'll put this machine on and increment higher pressure, 5, 10, 15, and they'll come to a pressure where it keeps it open. And the dentists now are getting in on the action. So what it does, they make this appliance, they call it oral appliance. If you notice, these are his natural teeth. This grayer thing is this little cap. It looks like a denture, the hollow thing. So what it does is that, see how it's slid further up than this? This is the natural position of the upper teeth. The lower teeth are ahead, which is just the opposite. If you make a bite, the lower jaw is below or under the upper jaw. So it kind of does that, pulling it up, and it has a little hex key inside, and you can move it a little bit every night till you can wear it and not snore. Super, super expensive. That machine was $150. These things are like $4,000.
Like a sleep pill that kind of makes me do that.
Does it work for you?
Yeah, it's a snoring pillow, and it really helps actually.
Oh, cool. So now this is something new that is in the market. I don't sell it, I just wanted to bring it. So this is a very pretty cool thing. It's a little sticker, and you would just apply it, and it's like a $16, $17 a night, and then you have to just kind of throw it. And so this is just a commercial. Again, I have no
Proven
connection.
sleep apnea therapy is a nightly single-use device indicated for the treatment of mild, moderate, and severe obstructive sleep apnea, or OSA, that utilizes nasal expiratory positive airway pressure, or EPAP. Attached with a hypoallergenic adhesive and placed over the nostrils, ProVent therapy incorporates a novel microvalve design. During inhalation, the valves open, allowing essentially normal airflow. Then during exhalation, the valves close, directing airflow through small apertures, which increases the pressure in the airway until the next inspiration. This helps maintain airway patency during sleep.
So it's pretty, now I just wanted to take a couple of minutes to just show you the medication one. And where is it? Okay. Here. Okay, yeah, because it's running already. Okay. Main chapters.
I noticed they had a whole section on women or sleep.
Yeah, because it's a different.
I bet it is.
Yeah. So here, I wanted to just show you things about, these are the, let's see, next. Oh, so let me find the graph. Okay, so here. Now they're showing you the sleep latency time. So what does that mean is that this is a subjective
Timer
sleep.
will close in 15 minutes. Please conclude your
It's the
computer use,
subjective
finish
sleep
your printing,
latency
and
time.
renometer
These are the red
percent
one.
circulation data.
So this is how long you think it is taking you to fall asleep. Okay? It's not actual time, this is what you think. So these are the people on placebo, these are the people taking the drugs. So the placebo people thought that it was, this is at the baseline, before they given any drugs. They thought they were taking 75 minutes to sleep, and they were a sugar pill, and it took them 40 minutes or 45 minutes to sleep. So, and here's people who actually took the drugs. So this was 75 minutes, it was thinker, and this is 35. So on the best day, you're cutting down the time by 30 minutes by taking the pill. Okay? And what was the actual, was the sleep duration? So these are the people who thought they slept around 350 minutes without the pill, and they thought they slept 410 minutes or so with the pill. And this is the thing. And this is then if you mix the pills with other things. And I wanted to show you another one. These are Sonata. This is the one. Okay. So this is what it increases. This is what the drug company is telling you, okay, not me. And this is something that I wanted to show you. So you're sleeping in 50 minutes, right? On
Falling
week
asleep.
1.
Okay.
Here, you are sleeping in how many? Like under 30 minutes. So in 4 weeks, you have dropped you're sleeping 20 minutes faster than you did before. Look at this here. You were sleeping without the pill. That's what no, that was the placebo. So without the pill, you are sleeping 20 minutes faster. With the pills, the higher dose, this purple is a higher dose, you are sleeping at about 40 something minutes. And with the drug, you are sleeping around 27 minutes or so. So the difference is like 10 minutes. And yeah, so to me, if you could come down from here to here without anything, you could probably go from here to here without anything.
Yeah, but it's also staying asleep during the rest.
But that's not what the drug is selling you for. This is just the sleep onset, the insomnia. Now, the newer one that they have is it's the same drug, it's the different packaging, and that's calling it the intermezzo, which is the same drug with the different packaging. And that one is you take it in the middle of the night. If you get up to go back and remain asleep, then they'll tell your patient not to take it like at 4 o'clock in the morning, because then they would like yeah. So one of the first thing I do with the people is the sleep hygiene. The sleep hygiene then in the turn-on is tell you for free what it is. You cut down the caffeine, the light, develop a ritual. A ritual is like taking the bath or whatever it is, exposure to darker light. If you don't sleep in 45 to 50 minutes, then you get out of the bed, do something boring, listen to music. Just keep searching for something, and I like your idea. You found that little bit NPR that's kind of not exactly tuned in works for you. Some people, there are so many free apps on this that you can find that plays a little music for you and sleep and things like that. But if somebody tells you that you are snoring and you're waking up from your own, if you're waking up with a headache in the morning and things like those are clear signs. The long-term sequela of the apnea and insomnia is not just the mental health, but the cardiovascular health, the risk of stroke and heart attacks are really, really high. And the most recent survey shows that 1/3 of the Americans don't get enough sleep, and the other 2/3 are unemployed. So then, so it's hard. So if you're not getting enough sleep, please do what you can.
Yeah, you left out traffic accident.
Yeah, traffic accident. My last day, June 30th, of doing the night shift, so I would work from 5 p.m. to 8. And my very, very last day, they told me to come in at 8 o'clock to take this exam. And so it was June 30th. July 1st, it's over. So I went in at 8 o'clock, I fell asleep, I rear-ended another lady, and really pretty good. I totaled my Jeep, broke 4 bones in my hand. Yeah, I ended up getting surgery, put plates and the screws, stayed home, and then they told me I didn't have the disability insurance. And then the hospital, to add the injury to the insult to the injury, sent me a bill for $2,000. The ambulance company sent me a bill for $700. I got homeless people drove to my ambulance because they wanted a sandwich. Yeah, all the time. And it's like, I work here, you remember, and yeah.
You should have talk about melatonin a little bit.
Oh, right, yeah, the melatonin is an excellent topic. So the melatonin is a natural product that comes from the pineal gland. The problem with the melatonin is that the light will suppress the secretion. So your body will constantly, as you age then, we saw that those people are not staying asleep because the melatonin production has gone down. So you can take melatonin. The problem with the melatonin since it's over the counter, it's not regulated in terms of when they give you the powder and they tell you the weight, it is the weight of the powder that they're telling you. not how much melatonin is in that powder, over-the-counter thing, yeah. So you have to get it from a reputable, there is a prescription version of it, I think it's called Remaltion, and so that you can take. There are some standardized company that'll use the proper pharmaceutical standardization. You can buy it from a reputable company that will do. But the trouble with the melatonin is that you have to time it. You have to time it right when you take it. And plus you also have to practice all the other sleep hygiene to be able to do it.
So, right off the top of my head, I can't recall which ones they are, but I've heard of, like with, say, some people in like hormone replacement therapy or things like that, if they take a certain hormone that's externally produced, like it's introduced into their body will stop making it.
Well,
Can
that's
that happen
true.
with melatonin?
Yeah, but the melatonin, that's why I say it's tricky, because if your body is making it, that's what I'm saying, you have to stop and practice the
No,
proper
I mean
hygiene.
long,
Yeah,
I mean long term.
absolutely, yeah. If you take melatonin, you'll stop making it. You'll stop making it. That's why you should only take it after you have practiced all the other sleep hygiene. So you have done the light, you have done the caffeine, you have done everything else, then take. That is true for any hormones that
Yeah, I
are
think-
external.
And I think the other thing with getting melatonin is exposure to natural light in the morning has something to do with getting your body to make it later.
Yeah, so that's why it is so tricky trying to fool your brain with the external hormone. And that's why people will just say, oh, take melatonin. So they say, well, I couldn't sleep, so I waited till 3 in the morning, and then I took melatonin. No, you gotta time it. You gotta time it right. And the problem with any hormone is exactly what you said, that you will suppress your own production. So the problem is when the people start treating their own ailment with your self-pharmacology, it's a problem.
So are there known cases where, say, a person who has had lifelong sleeping problems and they practice proper sleep hygiene, but they, they'll take melatonin to initially get to sleep in the evening? Are there any cases where then later, like say, when they become elderly, their natural melatonin levels production has gone down so far that they just
Absolutely.
can't do it?
Absolutely. When you get old, not only you have the lost melatonin, you have the phase shift. You are sleeping earlier and waking up, so now your exposure to light has changed. Then there is this whole industry about exposing yourself to the right light in the morning to wake you up. So you can go to Costco and buy this light things that are blue lights, and you expose yourself to it. And my advisor has this whole lecture. So you have to have a right wavelength. It's like 450 nanometer. You have to have so much brightness, and it has to be so far away. We have patients, inpatient, they'll tell you, oh, I can't sleep. Well, what time did you get up? 11. And then what did you do? I ate lunch, and I slept again. And then what time did you get up? Like, 4:30. Well, of course you can't sleep. You're taking all these naps throughout the day, so you're not able to sleep. Oh, that's a part of the sleep hygiene I forgot. No naps.
Yeah, that's a big problem.
No naps to read.
Yeah.
But I couldn't sleep, so I'm going to take a nap in the
That's a
afternoon.
killer.
Like, no, don't take any nap. Because
Yeah.
That's a murder.
Well, my question